Hello, my name is Singleton. I'm a student here in the phlebotomy class at Patch, and I have sickle cell disease, and I'm just here to tell you guys a little bit about it. Well, my mom and dad, they both had the trait, so that's how I got the full-blown disease because it's inherited. It's a blood disorder. We have abnormal hemoglobin, and hemoglobin is the protein that's in the red blood cells that carries oxygen throughout the body. Inherited means that the disease is passed by genes from parents to their children, and sickle cell is not contagious. People with sickle cell, you inherit 2 abnormal hemoglobin cells from the parents, and the red blood cells are not normal. They're like shaped like a crescent moon, and so it's not like, it causes like really bad pain because it's not as flexible as the normal red blood cells to go through the vessel, so it like sticks to the walls and stuff, and it like causes blockage and stuff, and so it causes very bad pain. Because you know, if your oxygen can't reach your tissues, and somehow it causes it to hurt. So yeah. Okay, and like when you get attacked by the pain suddenly, it's called pain crisis, and it often occurs without warning. It can be ongoing, and sometimes a person needs to go to a hospital to get effective treating to try to get the pain control. Sickle cell is like, you know, poor oxygen. It can cause organ damage. It can be harmful for a person, like harm your brain, your spleen, your lungs, your liver, all your organs. It can cause like bad things to happen. So like your body is, most people's body always make like new red blood cells, but with sickle cell, like it doesn't make enough, because it destroys, but ours don't make enough to keep lasting. So it causes you to have anemia. That causes you to have like less energy, tired, cold, and things like that. So that's like about it about sickle cell. If you guys have any questions, feel free to ask.
I know there are different types of sickle cells, right?
Yeah, they are. It's SS, SC, and a few other ones they came about with that.
What type do you have?
I have SS. What's SS? The SS disease is the most common type of sickle cell disease. It occurs when it's in hereditary copies of the hemoglobin S gene from both parents. So basically, I just have both of the S genes from both of my parents.
So you have SS? Okay.
How often do you get pain from it? Like, is it every month, every couple months, every couple weeks?
It's like every once in a blue moon now, because I'm on like this new medication they have. It's called hydroxyurea, and you use it in most cancer patients, but they found that it can help me produce more fetal red blood cells and keep the sickle cells away. So as long as I take it, it keeps building more cells, and it's been working like pretty good for me. So.
What kind of tubes do they draw? What color tubes they draw?
They use the purple lavender tubes when they do labs on me, because that's the tubes that are used for hemoglobin.
Okay, I have one more question. I guess it's the last question. If they... Sorry.
So what's your question, Monica?
How can you describe your pain? Or how do you know, is you going to start with a crisis or a crisis? I don't know.
It'll start out like a little cramp, like I really can't describe it to people because I've had a broken arm before. It doesn't feel like that.
Is it worse?
It's worse than that. And I've never had a child before, but I heard from people that had kids say that it's worse than them, like doing childbirth.
Oh, okay. I have a question. I heard that they have bone marrow transplant that actually kind of cures sickle cell patients, but you have to be in the hospital for a year after the surgery. Would you ever consider doing a bone marrow transplant?
No, because it gives you a higher chance of death.
That's true.
Yeah.
So there's definitely no cure for it.
No, they're trying to find things that can cure it. Like they always say bone marrow transplant, but I will never get that ever. I'll just suffer with that.